Okay, Brad Stoddard, it's great talking to you. Welcome to the podcast.
Hey,
Thank you for
thanks.
joining
Glad
me.
to be here.
Thank you for joining me. I did the idea of what you do, the administration side of mental health care and organizing the business side of it. Something that a lot of us doctors know nothing about. We're not very good at it, but you make it possible. You make it possible for a lot of people to get help. Tell us a little bit about the business that you started and the Sunrise Mental Health facility.
Yeah, so I am not clinical at all. I went to school and got my MBA. Always wanted to be in healthcare, but the cards never played out like that. So it was so lucky after I got my MBA that I was able to join a hospital group and was their director of patient financial services. And so I learned about the insurances, the ins and outs, and I think they were just desperate to have anybody, even though I didn't have experience. And I later found out they had fired the previous 4 directors in front of me. And so they gave me a shot. And it went really well. I found out I was really good at bringing business and healthcare together. And so you're absolutely right. I've met so many doctors and worked with so many doctors and clinicians that all they want to do is work with the patients and do patient care and provide excellent service. But unfortunately, the business side is always there. You have front desk people that need to be trained and hired. You have billing, which is a huge part because you can give exceptional care, but if you don't get paid for it, then that's a huge issue. So I'm lucky to be able to jump in and handle all those situations, definitely from a different perspective and from more energy. I feel so bad for so many entrepreneurs who are doctors who open up a clinic and they're giving it their all to patient care. And then there's just not a lot left in the tank to handle HR issues and, payroll and all the other stuff that goes with it. But yeah, like you said, right now I own Sunrise Mental Health. And in Arizona, a layman can own a healthcare company as long as I'm not running the healthcare side. So we have a medical director that is in charge of that. But it's nice because it allows me to focus on the customer experience. How are we doing referrals? I can go out there and build the business. I can manage our online presence. I can do all these things that lots of doctors can't do because they're giving patient care. So I'm in a really unique situation right now.
Yeah, and one approach that a lot of us have taken, doctors that don't want to work within that system, is that we try to simplify things and say, okay, we're not going to deal with insurance, we're not going to deal with staff, and that does work on a limited scale. But when you want to help everybody, you want to make sure that the doors are open for anybody that walks through and that you can help everybody that comes to you. You really can't avoid that stuff. You have to be able to work with it, with the system, and it does get very complicated. And it's so what you're doing is really incredible, and it's important because everybody deserves to have access to good mental health care.
Yeah, and you're absolutely right. It is really hard to do both, but it is possible. And you're right about there are a lot of providers who they're just like, you know what, insurance is such a nightmare and such a mess that I'm just going to stick to self pay. And you're right. You can help a small amount of people, but if you want to be able to scale your business, there's only so many self pay people that are willing to pay in your area for it. And so one of my goals was growth. We wanted to help as many people as possible. And to be able to do that, we have to go through insurance because most people want to use their insurance. They're paying a monthly premium for it and they want to use it. So that's why we decided to use insurance and work with insurance, even though it is a hassle, because we can grow faster than just self-pay.
Yeah. And so, what kinds of conditions can people come to Sunrise for? What are the most common things you treat, and the range of conditions that you can treat there?
So I think a lot of it is due to TikTok. You have those TikTok diagnoses, but we've seen a huge uptick in ADHD. So right now we're handling a lot of ADHD, a lot of women. I would say the majority of people calling us are adult women who, saw TikTok or something and they just are like, wow, maybe I have it. So we do ADHD, depression, anxiety, OCD, PTSD, and we're experts at medication management. We also provide therapy with that because we feel like it provides a better outcome than just that medication management. So our first appointments are about 50 minutes long, and then follow-ups are about 20 to 25 minutes long instead of just like a 3-minute med check.
Oh, that's great. That's great. And I know something with related to addiction care, which was really important, was the part of the Affordable Care Act. They have that part of it that says that everybody deserves to get, or everybody has to have access to mental health care equally to any other condition. That they can't limit mental health care. And I know that helps people with getting addiction treatment. And I would imagine across the board for any kind of mental health care is that insurance companies can't refuse to help people when they need help with mental health.
Yeah, it is interesting. A lot of the commercial payers will have a carve out. So they'll work for Boeing or they'll work for the McDonald's Corporation, and let's say that they have Blue Cross Blue Shield. What's interesting is they'll have a carve out for mental health. And that can be a challenge too, because the patient doesn't know that they have a carve out. So they'll present that they have Blue Cross Blue Shield, and then we'll find out by reading their card, it's actually a carve out to something else. So I wonder if that's the reason that they are doing carve outs, because they are required to provide mental health care. But sometimes it's not combined. So if you're in mental health, you have to be on the lookout for those carve outs, because sometimes the patient doesn't even know that they have a separate insurance payer that's covering their mental health.
Yeah. Wow. So what is it for a patient that comes in? Like what kind of facility? What does it look like? How big of a place is that Sunrise?
Yep. So we're on to our second office already. We've been in business less than a year, but we outgrew our first place. And so we really wanted to have a place that didn't feel sterile. And so when you come in, there's a mid-century modern feel to our place that's kind of upscale, because we want people to feel like, the perception of care is a real thing. And so the way that your office looks and how many times the trash gets taken out, that's all so important, because you get judged, right when that patient walks in the door. So we try to keep our offices very clean, very minimal. We don't have a lot of clutter. We don't have a lot of things posted on the walls unless it's mandated by law. And then we just want people to come in and just feel calm. So we have nice music. What I try to do is try to go above and beyond. And so we have drinks and snacks. We have a sparkling water, and we have Diet Coke, and we have jerky and granola bars, and we have all this stuff to make a little haven for people. So when they come in, instead of like, oh my gosh, I'm here again at my mental health provider, they come in and then they just have a sigh of relief that they're there. And then we have calm music, we have the snacks, and then we provide excellent care. So kind of a little bit different than lots of other places.
Yeah. That sounds really good. It makes me want to go visit now. It reminds me of one of our kids' orthodontists, that they had a coffee bar in the waiting room. And that was my favorite part about going in. I
Oh,
looked forward to taking them
wow.
in. Yeah, it was good
Yeah,
coffee too.
yeah, and that's another thing. Like a lot of times, the patients will have a caretaker, either a spouse or a partner or somebody who comes in with them. And so, yeah, it's just another thing to make their experience a little bit better as they're waiting for their loved one to get seen by us. They can have a little treat and enjoy the ambiance a little bit. So, yeah, that's interesting about that's a great thing. Maybe we'll have a coffee bar soon.
Yeah, it sounds great. Yeah, in fact, in my mother's building, they I don't know if they still have it. They I wish I knew the name of it. They had some kind of a fancy, those machines that are all in one that can make any kind of coffee.
Oh, the
They had
Keurig,
one.
yeah.
Yeah, well they had one, not the Keurig, but one of those machines that like you just put your cup under it and you don't even have to put the pot in. It just grinds the coffee. It grinds it inside the machine. And there's somehow actually made really good coffee. The funny thing about it is the machine is supposed to charge people, and somebody set it to give out free coffees. So yeah, I just love going to visit my mother when that machine was out. But
but I think that's so great. Like those two places you mentioned, they're thinking outside the box because they just don't want the patient to come in and leave. They want it to be a better experience. So I think that's awesome of them to do that.
yeah, yeah, definitely. Yeah, that's great though. Just the idea of like, because nobody wants to go to, whether it's a psychiatrist or the dentist or whatever, and just to already have people in a good frame of mind just before they even come in to see their doctor or their healthcare provider is really great. So
Yeah, and then just making sure that your front desk person has a smile on their face. When I was trying to get ready to build this company, I read two books by Truett Cathy, the guy who started Chick-fil-A. And one of the things that he teaches is you can't train friendliness. And so when we're trying to hire, we make sure that that front desk person, because that's the first person the patient sees when they walk in, is a genuinely friendly person. And so that's another thing that we try to do is make sure that our staff are good people, they're happy people. Because I agree with Truett Cathy, you really can't motivate happiness or friendliness.
yeah, yeah, Chick-fil-A. Funny when you line up to go in Chick-fil-A, like I feel like I'm in a line for Disney World or something. It's there's something about it. You feel like something good is coming up.
Yeah, I actually grabbed about 20 points from those two books about how to start a company like Chick-fil-A. And that's kind of our foundation, our principles. We try to build off that. So I joke all the time that we're the Chick-fil-A of psychiatry. Just because when you go to Chick-fil-A versus Taco Bell or McDonald's, it's a night and day difference of customer experience. And so that's what we try to be. And the good thing is, as owners of the company, we have control over that, about who we hire and who we don't hire. So we definitely have the ability to make sure we're choosing the right people to greet our customers.
Yeah, yeah, and you remind me also of I just saw, I think it was on social media. They were showing like different clips of that founder movie, with
Oh
about the
yeah,
founding of McDonald's, and they
Michael
showed
Keaton. Yeah,
they showed that scene where it was like half the tennis court where the McDonald's guys like laid out the whole kitchen and perfected their process of how the kitchen would work and had everybody come out to the tennis court and pretend they're making food.
yeah, and that's really what you have to do. Just recently, I started looking at our business from A to Z. Exactly what they were doing in that movie. They wanted to find out the process from A to Z, and that's what we have to do as business owners. Is you have to understand what happens the minute that person calls us. Does it go to voicemail? Are our front desk people answering the phone, or does it go to voicemail and a recording that says, "We'll call you in 48 hours"? If you're a doctor who's trying to grow your business, that's one of the easiest things you can do is make sure you're answering your phone. But that's what we do is we went from A to Z and we tweaked little things about what can we do to answer the phone faster, call back people faster, call the referral faster. When a voicemail call, is left, what can we do? And so I think that movie did such a great job of doing that. But all doctors need to step back and take a look and see what is the customer experience from A to Z. And just like they did on that tennis court, you have to understand where are the points that are frustrating for a patient, and then see if you can tweak them a little bit to make them less frustrating.
Well, yeah, that's great. I think a lot of like healthcare facilities don't really maybe don't think all that stuff through. Especially with you hear the common kind of nightmare of patients saying that they barely saw the doctor, they kind of ran in and ran out, and and just not enough time being given to or attention being given to the care of the patient.
Yeah. Yeah. And I think a lot of people, just because lots of specialties are underserved in America, a lot of people don't have to try hard, to get patients because there's always going to be a default where you're like, well, gosh, they have a 2.2 rating, but I need to go into this cardiologist because I need care. But if doctors want to grow their practice, then they can't be just happy with the 2.2. And like you said, this pop in, pop out. They have to find out how to engage the patient more. And if they can do that, then they'll be able to grow and get more patients. Because one of the things that has helped us a lot is we're getting referrals from our referrals from our referrals. And that means, Bob comes in, has a great experience. He's at work the next day and somebody's complaining about depression or anxiety. And Bob's the one who is our advertising. And he's like, you know what? I just went to Sunrise Mental Health. They were so nice. They had San Pellegrino in the waiting room. The music was really nice. And then that person is now a walking billboard for us. And it just continues. We've already had, even though we've been in business very shortly, we've had a referral of a referral of a referral come into us because they've heard about how great we are. And so it really is important that patient interaction pays dividends because, as you're trying to grow your business, you need people out there talking about you, even when you're not asking them to.
Wow. Yeah, that's really good. What about telemedicine? Are you guys involved in telemedicine right now?
Yeah, because COVID, we definitely see the value in that. Surprisingly, as we're getting new patients, the majority of them still want to be seen face to face. So we offer in person, and we also offer telehealth. But what I've noticed is, as soon as that patient has a good connection with our psychiatric provider, then they'll switch over to telehealth, because you really can't beat telehealth for, it's so simple. You don't have to leave your house. You don't have to drive to the clinic. You can just go in your car if you have a good connection and do the appointment through your car. And so we offer that because there's a lot of people, we work with a lot of college students, and they would just want to do a telehealth visit. So it's good to offer both modalities.
Oh, is that throughout the entire state of Arizona?
Yep. As of right now, it might change later this year. It was supposed to change. The Riot and Hate Act was kind of put on hold for several years during COVID, and then they were going to bring it back. And basically, that changes what you can and can't prescribe via telehealth, and you have to see the person in person, to see the patient in person before you can prescribe certain things. That has been placed on hold again as the government's getting more and more comments about how they should proceed. But right now, we can do telehealth without seeing the patient. And then if it does get required that they have to be seen in person, then we'll just pivot and make it work. But we're not worried about that at all.
Yeah, and I was wondering about that. Would they have to see you in person every visit, or is that just like periodically?
So how the rule is written right now, it's once for every 2 years of care. And so that really isn't hard. If we've had the patient, they fall in love with us, and we're like, gosh, I know that you're an hour away, but just come in once and then we can give you care for the next 2 years. And that's just up until as it's written right now. My guess is they're going to tweak it because everybody has moved to telehealth, and it's such a benefit, especially in, Arizona is huge. And, we have people who are, 3 hours away from our clinic because there's no specialists in their area. And so it does seem silly to make them drive 3 hours when we could just do it over a video call just as fine.
Yeah. And there's some big telehealth companies that I guess on one hand there are competitors, but on the other hand there are advocates, because they're out there lobbying and fighting to keep things going, because that's their whole business is telehealth. So yeah, we have them on our side, at least in that aspect of hopefully keeping things workable, not inconveniencing people that so they don't have to travel far for care and everything. So
and we have a really great our former lawyer, mayor or governor, he's actually Governor Ducey. During COVID, he signed a law that said telehealth, everything that went to telehealth, all the changes are to be made permanent. Because I know some states have rolled back some of their telehealth abilities. and he saw the benefits of it. With my old company, we'd have somebody in Page, Arizona, which is right way up at the tippy top of Arizona, right on the border of Utah. And our specialist that was treating them was in Phoenix. That's 6 hours away. And so what a great blessing for that patient just to do a telehealth visit instead of saying, hey, you know what? We know you well, but you're gonna have to drive 6 hours to see us. And so I'm really hopeful that they keep the changes, because it really has expanded care to a lot of people who weren't getting it before.
Yeah. Is that like just Arizona, or are you able to help people in other states?
Right now we're just Arizona, and we'll probably just stay in Arizona for a
Yeah.
while. I think that's kind of a fallacy of some people, is they're like, well, if I could just get into another state, I could grow faster. But we just want to keep it close to us, so we can make sure that the quality of standard doesn't decrease. And sometimes when you expand farther away, the quality of care will decrease because you're not there to keep your finger on the pulse.
Yeah, I agree. I like Florida. I just stay in Florida. Yeah, the idea of trying to maintain and work with the laws of different states seems kind of overwhelming to me. But
Yeah, and there's plenty of people in Florida.
yeah,
So I think that's the better way to do it. I think there's so much need in Arizona that we don't have a need to go outside of it.
yeah. Now you had mentioned college students. What universities are in Arizona?
But we have three major ones: University of Arizona, which is in Flagstaff, and then ASU, Arizona State, in Tempe, Arizona, which is by Phoenix, and then University of Arizona, which is in Tucson. And with my old company, college students were a huge demographic that we served. A lot of times they're coming from out of state, and so they don't have care because their provider isn't licensed in Arizona. So if you're in an area that has a college, and a lot of them are struggling with depression, anxiety, ADHD. A lot of these college students started college during COVID, and it's been a challenge for them. So we try to create a really good relationship with the university, and we can help take off some of those patients that might be slipping through the cracks or they can't care for anymore. So I think colleges are a huge impact on business.
Yeah, yeah. It's stressful, going to college, and then I can imagine, things that might not have a person might have been dealing with um, through high school. Suddenly you're out on your own, and depression, anxiety, things catch up to you, and now you have to deal with taking on college. Now you hear everybody saying that this is it. Like, you have to perform. You have to you're gonna have to go to work someday and do something well here. So it's a lot of stress to be put on someone that a new adult suddenly out in the world in college.
Yeah. So we try to create a good relationship with them. And back to just being fast, when they send us a referral, we jump on it the same day. I know some doctors' offices, when they get a referral from a PCP, it's not an importance to them. It's just kind of sits there for a couple days or even a week or two. And the University of Arizona knows that if they send us a referral, that we will call the patient the same day, which just makes them want to send us more patients, and then we can grow and help more people.
Yeah, it's true. Yeah. It's that's kind of a problem all throughout healthcare of like the delay to treatment, the time it takes to actually get an appointment and talk to somebody. Yeah, that's really important. Same day. So people can they'll get a call right away, or they'll be able to get through to someone right away and get a visit pretty quickly.
Yeah, and I know when I call family practice doctors and I'll leave a voicemail, several of them do say, like, we will call you within 48 hours. And I tell my staff we should be calling patients back in 4 to 8 minutes is what our turnaround time is. And I think back to that, a lot of practices, they get patients no matter what. Whether they're fast or slow, they're still going to get patients. But our job is we want to grow. We want to help as many people as possible. And so if we're really fast, and I love it when we surprise a patient and they're just like, oh my gosh, I just left you a voicemail 3 minutes ago. I'm not used to this. It just makes us stand out a little bit more.
Yeah. So you've prioritized that. That's your priority. Where other people, other businesses or doctors or facilities may have other priorities. Like you've, and I think that's unusual. I mean, I don't think that's a common thing of let's make customer service and responsiveness a priority.
Yeah, and so I was, when we first started, I was answering the phones, and I still do answer a lot of phones because we're so small. But the last month that I answering the phones full time, I signed up 4 new patients in 1 week because they called. I was on the phone with somebody else, and I called back the missed call, even though they didn't leave a voicemail. I called them back and I said, hey, this is Brad with Sunrise Mental Health. I'm so sorry, I was helping another patient. I saw that you called. Can I help you out? And I signed up 4 new patients that were just calling down the list in Google. And we were the only ones that had called back. And so that's another policy of ours is we call back all missed calls. Because if somebody's calling you, whether they're an established patient or a new patient, they're calling you for a reason. And I think a lot of front desk people, when they see that missed call, they just don't care. They're just like, they'll call back. But we go above and beyond and we call them back. And it either gets us in front of a problem. So maybe a patient is calling about a prescription issue, and now we can attack that problem and get it solved fast. Or it's a new patient that's just calling and they just keep getting voicemails, and we're the first person to call back. So once again, it makes us look good. And the people are like, oh my gosh, I can't believe you're calling me back. I didn't leave a voicemail. So it just makes us look really good.
Wow. Well, yeah, I wish you could be everywhere. I wish you could go fix all of healthcare. I mean, we need you everywhere. And maybe you can clone yourself. And yeah,
Well,
there's so much of healthcare is broken, and just that responsiveness and letting people know that you care and being there for them. That's really great.
Well, I think it goes back to what you were saying at the beginning, Mark, that doctors, they care. They truly care about their patients, but they can't be in charge of giving care, and they can't be in charge of making sure that the front desk people know how to answer their phones, right? So that's why it's so important to find a manager that has the same values as the doctor and truly, truly cares about the patients, because then they can just be like, hey, remember, we call back every missed call, and then that manager can do that. Because it's so hard for a doctor who is trying to do it all to make sure that customer experience is really, really high. I feel for that demographic that can't be everywhere at once, but truly cares.
Yeah. It's it's kind of like the again, the Chick-fil-A analogy. Like there used to be there was this guy on the beach years ago when I was in high school that he made burgers and had a little burger stand. He made the greatest burgers in the world, and you'd have to go out to the beach and stand in line. And it was just one guy making burgers on a grill. But who knows what happened to him? He disappeared. And but yeah. But then you have this place where you get in line. You feel good about sitting in your car in a line, and these nice, cheerful people giving you a number and taking your order and everything. It's like, bags of food. The kids love it and everything. Yeah, I mean, it's just scaling up and making everybody happy and taking care of everybody and making people feel good about it. It's really a great thing. And it's not the guy in the kitchen who, he can't do that. He can't go to the Chick-fil-A, the people making the chicken, and say, we need you to go out and take orders on the line or something. I mean, everybody has their part to play in it. So yeah, but that whole system, the idea of it, like, why does one, and that's true in a lot of businesses, when something works really, like here, the big grocery store in our neighborhood is Publix, which I know they don't have everywhere. And you kind of take for granted how well run the place is when you go into like any other supermarket. You're like, I didn't realize that it's such a keeping the food at the right temperature in the freezers and refrigerators, and making sure everything is fresh and making sure that the place isn't dirty and strange looking. you really realize like there's a lot that goes into keeping this place clean and organized.
Yeah, and it's just it kind of falls down to the value of the company. It's because it's not rocket science to make sure that your clinic is super clean. That's not crazy, but I've been in clinics that maybe they weren't changing the trash out as often as possible. One thing that I did when I was running a surgery center was I noticed that on colonoscopy days, the bathrooms got a little bit dirty during colonoscopy days. So I had my staff clean it twice a day because, and we didn't have to. It's not like we're required by law, but I wanted that feel to be. I wanted our patients to feel good when they came in. And so we recognized the problem and then we just created a super simple solution. So when doctors find a problem or they know that patients don't like something, instead of just being like throwing up your hands and being like, well, gosh, I wish it was different, change it. You have the ability to make changes. So I encourage people to actually make the changes. If you have a sticking point and you've had 10 patients say, you know what, we love your clinic, but XYZ happens, then take time to think about what can you do to make that not a frustration anymore. And your patients will thank you for it.
Yeah. Well, Brad, thank you for joining me. This is incredible. I think doctors and patients will get a lot out of listening to this conversation and hearing this incredible wisdom that you've shared with us here. Thank you.
Hey, you're welcome. My pleasure. And I just want to leave with doctors, like, I know how hard it is to do both when you are running the whole show by yourself. But try to hire people who have the same values and care as much as you so they can carry on the work that you want to see done. But I've really enjoyed my time with you, Mark. Thanks so much.
Thank you. Thank you.